All right, joining me now is Dr. Peter McCullough with the Wellness Company. Dr. McCullough, welcome back to the broadcast. Thanks for being with us.
Thanks for having me.
Dr. McCullough, you have the McCullough Foundation, and today you have this out. Neurological and cardiac complications from COVID-19 vaccines have fatality rates of 5.9% and 2.5% respectively. 698 vaccines were included in the systematic review, of which 259, 37.1%, had cardiac, and 439, 62.9%, had neurological complications. Tell me more about this, because your foundation, I mean, it's almost a daily basis. You guys are putting out all of these astonishing reports.
Yeah, the foundation has its first pillar, which is investigative scholarship. So this Nick Hulscher, our fellow, a recent graduate from University of Michigan School of Public Health, is really doing an outstanding job. This study was posted in the National Library of Medicine. And, you know, the mainstream media doesn't pick up on this, but, you know, doctors who are investigating this are finding these neurologic and cardiovascular syndromes not only are morbid, I mean, people are really damaged by these vaccines, but, you know, in high percentages, they're fatal.
High percentages, they are fatal. Now, when you put out reports like this, Dr. McCullough, and I'll go back to the screenshot here, I mean, these are very documented reports. What kind of response do you get? I mean, other than conservative media, do you get anybody else reaching out to you outside of conservative media or doctors or doctors' associations? Are you making any headway other than with just us conservatives?
You know, slowly but surely, I think our circles are expanding. But I get your point, Brandon. There's not a single chief of medicine in the United States, despite these manuscripts coming in and mounting over time, not a single chief of medicine that said, you know, I'm concerned about this. I'm concerned about these reports of the vaccines causing injuries, disabilities, and deaths. And what people keep asking me is when are they going to come out and face the music? And, you know, the examples I've used is Ignaz Semmelweis in the mid-19th century in Vienna had the data that doctors were spreading infections from women to women with their hands, with pelvic exams. He had the data. He presented it just like this paper, and it was 20 years he was castigated, censored, kicked out of medical societies, castigated. He died in an insane asylum. And then 20 years later, the doctors are like, oh yeah, Semmelweis is right. We should have been washing our hands. Or Rosenhill, when they presented to the Medical Research Council in Britain, that smoking causes lung cancer, 1949, 1950. It's 20 years later, we get the U.S. Surgeon General report that says, yeah, smoking causes lung cancer. Doctors were smoking, nurses were smoking, they were advertising cigarettes. These examples show us, Brandon, the medical orthodoxy does not turn quickly when they're wrong on an issue, and they are deeply wrong on these vaccines. The public knows it, the independent media knows it, and all we can do is just continue to review and present the truth to the world.
At what point do these numbers of deaths, I think I just read in my Worldview report the other night of a ballerina that died.
Yeah.
I mean, it's just constantly healthy people. I don't think ballerinas tend to be overweight, obese people, all right? They tend to be pretty fit. I mean, the fittest you can be, right? And we just keep having these fit athletes die. Number one, why are the fit athletes dying? Does it have anything to do with their blood flow going up? They're out running, they're exercising. Why are these healthy athletes dying? And are they dying at higher numbers than overweight people?
It's so interesting. We see that athletes seem to preferentially be hit with what's called vaccine myopericarditis. The vaccine is taken up into the heart. It may be due to all this exercise and conditioning, increased myocardial blood flow. Crossan and colleagues from Harvard has found the messenger RNA of Pfizer, Moderna physically in the human heart months after the shots. And then the spike protein is produced there. The spike protein causes the damage and inflammation. And Bohmeyer from Germany has found that in young men hospitalized in Germany with vaccine myopericarditis. What we need to know is when we see these young people dying, If they've taken the vaccine, I can tell you the data all suggest it is the vaccine that's the cause of death and not something else. What became the norm after 2021 is simply not to mention their vaccine status. We saw social media scrubbing their prior posts on the vaccine. But indeed, the vaccine in a percentage of cases leads to injury to the heart. They never feel it. And then at the inopportune time, adrenaline and other factors converge, and the patient has a cardiac arrest, a small scar in the heart, reentrant ventricular tachycardia, ventricular fibrillation, and sudden death. So Hulscher and I have published this recently, this sequence in a paper that's in the preprint server system, saying we have to take action now to save more lives.
So would someone that got the same shot, but that was not as physically active with their heart rate going up, their heart pumping, would they have a less likelihood, if they're just sitting around a lot, very static, would they have a less likely chance of having a heart attack versus this individual who's more healthy, who's getting their heart up and running all the time?
It's possible, because they may not ever get that surge of adrenaline, that triggers the cardiac arrest. The other time it happens is between 3 a.m. and 6 a.m. But, it may just be that these athletes are in public view. They're at the picture perfect health. Many of them are screened for heart disease, so we know they're fine at baseline. And there's such obvious cases, so it's presented to us. But, all-cause mortality in almost all of the data systems, the life insurance systems across the world, is up considerably since 2021. So it points to the fact that average people are dying too. There's one group that, Brandon, you'll be shocked, that are protected against all of this. You'll never guess.
Who is that?
Smokers.
Really?
Yes. So smokers, in my office, I see patients, sadly, who have had heart damage and blood clots all day long. I just finished at the office today. I've never seen a smoker.
Why? Is that
because,
let me guess. I'm just a layman. I'm not a doctor. Does it have something to do with the cigarettes and the flow of their blood?
Well, you're close. The nicotine that one has with cigarettes, and the nicotine levels in the bloodstream are maintained because people go outside and smoke frequently. The nicotine blocks the spike protein from the infection and the vaccine, and they don't get long COVID. They don't get vaccine injury syndromes. In fact, we actually use a nicotine patch, a low-dose nicotine patch, in treating long COVID and vaccine injury syndromes.
So I'm not promoting this, but if someone were to if someone who had the shot started even putting on a nicotine patch or chewing nicotine gum, if they didn't want to take up smoking, would that lessen their chances?
Well, it doesn't lessen chances of serious things like cardiac arrest or blood clots, but it improves symptoms. And there's one peer-reviewed paper on this. We have vast clinical experience. So let's say someone took the vaccine and they have a loss of mental clarity or numbness and tingling, like neurologic symptoms. They do respond to a 7 milligram patch, which would be like Habitrol step 3. So it's the lowest dose patch. You can get that, over the counter at Amazon. So nicotine patches now have become a standard of care for long COVID vaccine injury symptoms. Now, what gets rid of the spike protein, and we think, ameliorates the risk, is McCullough protocol-based spike protein detoxification with nattokinase, bromelain, and curcumin. If I had this ballerina, for instance, and she was in my office and I had detected this, I also would have prescribed a critical drug called colchicine. Colchicine is mandatory for subclinical myopericarditis, and that plus detoxification, in my view, likely is going to prevent these cardiac arrests.
I want to show folks where they can get that here in a minute. But first, we here at on our Worldview Report, our 30-minute nightly newscast before Burning House Live, Leah Holman and I produce that together. And we are constantly putting in there the stories of these young athletes, ballerinas, boxers, whatever. High school students dropping dead on the field. What I never see in the reports in the local news, television, print, is the cause. No cause of death is given. No cause of death is given. This wonderful athletic young person died in their sleep. I read another one the other day. Died in their sleep. Okay.
Yeah.
I just read of today of a stewardess that just dropped dead in front of all the people on the plane, and she dropped dead. Of course, my question would be immediately, well, was she required by the airline to have the shot, right? So but so seldom do we ever put into the Worldview Report that the cause is being investigated and was being investigated and here's the result. It's always there's no cause given, and no one seems to ever follow back up. Oh, by the way, you remember the high school student that dropped dead on the field last month? Well, the report has come back and the student died from, we don't ever find these follow-up reports.
Well, Brandon, that's new. If you go back to reports like this before the pandemic, let's say 2015, 2016, every time there's a cause of death, there's some follow-up. It'll say, patient died on the athletic field, and an autopsy showed they had an abnormally thickened heart. It's called hypertrophic cardiomyopathy. Or you'll hear a story that, this celebrity died after a long battle with cancer. Or they died from complications of bypass surgery. But you'd always see that. And then they go on and give the eulogy, statements. But the new normal now is to just say they died without ever mentioning. And so it leaves open the possibility that, in fact, they died of a vaccine injury syndrome. I think it'd be helpful if they said they died of a long battle with cancer. Or a young ballerina. What if it said, well, she died of a drug overdose? Well, okay, she died of a drug. But to leave it open makes us very suspicious that it's a vaccine.
Yeah. Let me show you this before I ask him a few more questions here. Here it is, twc.health/Brandon. He mentioned the supplements. You just click all products, supplements, all products, and there it is right there, the spike right there. There it is. That's the first one up. Spike support formula.
Right. Now, Brandon, that's spike support. So that's nattokinase plus 5 minor ingredients. Now, we combine that with bromelain and curcumin, also offered by the wellness company. It's termed the Ultimate Spike Detox. Now, you can see the prices on this. We quickly get over $100. This is important. If the supplements are over $100 per month, there's the Spike Detox to the right to the right on this line. There it is, the three together. See the three together?
Oh, yeah. Mm-hmm.
See that? Now, look at that's $119. Patients are going to be on that for 12 months with McCullough protocol. The reason why I'm saying this, it's going to be cheaper to get a membership. It's called a One Wellness Elite membership. And that membership, you can choose the one that I think you can scroll down. There's more memberships. There's One Wellness Elite. Go under memberships, and you'll see there's one there. You got it right there. That one there. Get $99 per month. Look at what you get. So you're just going to cover all the supplements. Actually, as many supplements as you want. Keep scrolling down. You're going to have free prescriptions through the wellness company pharmacy. So take the existing prescriptions and free supplements, and then actually free telemedicine. If you ever need a doctor for something, you don't want to pay any doctor's fees. So listen, most everybody doing detoxification is going to want the One Wellness Elite membership. I got this for myself, and it's going to be like, in a sense, like a medical supplemental, because I'm doing the detoxification. I've had COVID 3 times, and I've had some symptoms, and I'm doing great on it. It just takes over a year. So most people on spike detoxification are going to do all 3, get the One Wellness Elite membership.
There you go. twc.health/Brandon. Use that. You'll save some money. They tell me if you use that URL, and we get some credit to help fund the program.
Yeah.
twc.health/Brandon. Okay, a couple more questions, Dr. McCullough. At what point, I think I even asked you this at CPAC at the desk, and we weren't there yet. So I'm going to ask you again. I haven't asked you this since. At what point does this start to get into numbers that, I don't know if the word I used at CPAC was genocide, but I don't know if there's a better medical term to use. At what point do the numbers get so high, the deaths, not counting the injuries, at what point did the deaths get so high on a national and global scale, and this was done on purpose at this point? They're not recalling it. The evidence is overwhelming what it's doing. They keep pushing it. They're even pushing it on, babies that are a few months old. So at what point does the word genocide come into play? Or is there another word, a medical term, another word that you prefer to use that describes all of these people being, I think, murdered through medicine deliberately.
Whether it's intentional or unintentional, the effect is the same. It's going to be population reduction. So we think about it, all-cause mortality is up everywhere. That means average life expectancy is down. And this is basically among the vaccinated. This has been shown now in papers. First authors were Mostert and Alexandria, data from the Czech Republic, all the safety data we see across Europe and the United States. So all-cause mortality is up, survival is down. And then importantly, reports out of Europe is that fertility is down. Don't forget, the vaccines affect sperm count and quality, and then they affect menstruation on the female side. So for sure, fertility is going to be down. So the net result is going to be a population reduction.
So maybe instead of genocide, the word would be a global eugenics program?
It's impossible to say. I mean, this idea of, mass negligent homicide would fit. Now, this intentionality of it, is there willful intent and all of that? It's just impossible to know. But we are going to experience population reduction. I think there's no way out of it at this point in time with the numbers that we're seeing. And it's not slowing down. I testified in Congress earlier this year, and people asked me, Dr. McCullough, how much longer is this going to go on? People took the shots in 2021. It turns out the most dangerous shots were in 2021. They actually became less dangerous in 2022 and 2023 and beyond. But the 2021 is when the vast majority of people took them. I estimate we've got 5 to 15 years from the last shot of worry.
Oh, 5 to 15 years. All right, I want to play one little clip here, then we're going to let you go. This is U.S. Senator Josh Hawley of Missouri. I don't know if you've seen this or not. It's 8.5 minutes, so we're not going to play it all. Just play a little bit. Whistleblower drops deeply disturbing report showing the CIA was paid to mislead the public on COVID. Listen to a little of this or get your response. Here we go.
Intelligence dangerously compromised warned CIA and FBI whistleblowers. You're not the only one to report this, of course. But I was reading your report on it this morning. This is something that you have been warning about for quite some time, and the allegations stem from a whistleblower who has come forward to the House, a whistleblower from the Central Intelligence Agency. I have the letter, the relevant letter here from the House Oversight Committee. The whistleblower alleges that a CIA team was paid to change its assessment of the origins of COVID-19. Do I have that broadly correct? Is that your understanding of the report? Yes. This is obviously a bombshell report, deeply, deeply troubling. I'm glad that the House is going to look into it. We should look into it. What caught my attention is you point out in your article on this that the government has deliberately violated the COVID Origins Act, which this body passed unanimously, which the House passed, the president signed into law. Maybe he wasn't so happy about signing it into law, but he did. It is the law of the land, and which required that all of the government's intelligence on the origins of COVID be made public. Instead, what the administration did was offer up a summary, which they then in turn heavily redacted. And you point out that in addition, the administration refused to report the names of scientists who fell ill at the Wuhan Institute of Virology in 2019, despite the fact they know the names. The intelligence community knows the names. Now, you're absolutely right to say this is a violation of the COVID Origins Act, and I would know because I wrote it. So I'm not very happy about the fact that this administration continues to flout, completely ignore public law passed, again, unanimously by the United States Senate. For what end, I can't tell. I can't figure out why in the world. I don't know what partisan game there is to it. Why in the world they want to lie to the American people.
Wow. Dr. McCullough, your thoughts?
Wow, I tell you what, this is a bombshell. I've been very clear with America that everything I knew from my scholarship is the SARS-CoV-2 virus did come out of this lab in Wuhan. The 2015 and 2016 papers from Vineet Menachery and Ralph Baric document the creation of this virus with the Chinese. It's a U.S.-Chinese collaboration. Anthony Fauci, Ralph Baric, Peter Daszak, and the bat lady Xingling Li. They are the four creators of SARS-CoV-2. What Josh Hawley is getting to is, do you know who the linchpin is on withholding the documents from that lab, it's actually Avril Haines, our director of national intelligence. Avril Haines was paired with George Gao, the CDC director, in Event 201. That's that October 2019 tabletop exercise that was filmed. And their job in that, their work group was, how do we deceive the public on the origins of SARS-CoV-2? So she's actually living out what she practiced in Event 201. And, she's formally with the World Economic Forum. So it can't be any more clear than that. I'm glad to hear that Josh is getting this out there, that indeed people did get sick in the lab. Patient 0, we think, was a lab technician who got out. She went to the fish market, got people sick. So it probably was a test tube or ventilation that went bad. And the first workers to die were those from the Wuhan lab.
Here is his X account. If you guys want to follow it, take a look at that, write it down. It's at P_McCullough MD, at P_McCullough MD. And you can also follow his website, which is petermcculloughmd.com, petermcculloughmd.com. And as always, Dr. McCullough, we always appreciate your reports. And I think I saw one of our Vigilant Fox, is that what it's called, Reagan? Vigilant Fox picked up one of our interviews from last week, and I think it did like 600,000 views.
Wow.
Now, they're telling me in my ear it's now 700,000 views.
Wow. So I tell you, that's the reach of Worldview Tube. I'm so glad you're...
Well, I think it's also the reach of the great information of Dr. McCullough, to be honest. and the reach of Vigilant Fox. And Worldview Tube. So it's a team effort, I guess, right?
Well, you're doing great work, and we're happy to...
Uh-oh. Well, we're glad to have you on board. It is a team effort, and we always appreciate our regular visits with you. Thank you, Dr. McCullough.
Thank you.
PeterMcCulloughMD.com, PeterMcCulloughMD.com, or follow him on X. All right, now.